Can the muzzle be reused after being purified with alcohol? With the spread of the new coronavirus COVID-19 and in the absence of treatment or vaccine to prevent infection, social divergence has become an effective means of preventing infection, but with the increase in the number of infected people, the need to wear a muzzle appeared when leaving the house and being in the gatherings, which makes some resort to re-sterilize them with ethyl alcohol and wear them again. What is the risk of that? Health magazine Alkenslow reviewed the damage of sterilization of the medical mask with alcohol, and the risks of wearing it more than once. The medical mask works to cover the nose, mouth, and a large part of the face, which reduces the chances of any flying mist that may be pregnant, so wearing it became necessary in light of the spread of infection, but that mask must be dealt with according to specific requirements, and he avoided a number of errors that could backfire, and cleansing the muzzle with any sterilizer that contains 70% of alcohol is one of the most dangerous of these dangerous habits, according to Live Science. The medical or surgical mask consists of 3 protective layers that reduce the chances of leaving or entering any fluids carrying the infection, and represents the first layer that touches the face of the person, as well as the last that faces the air as an insulator in order to prevent the arrival of any spray, whether the person is the source or flying from one of the transients. When spraying sterilizer or alcohol on the mask leads to the wear of the first and last layer of it without leaving a trace and making it worn out and lose its effectiveness in delivering any fluids carrying the infection, the damage may not be apparent, which causes some people to wear it again, which increases the chances of transmission of infection. So there are a number among the guidelines that must be followed when using a medical mask to prevent coronavirus infection, are the following. Avoid using single-use masks several times, as they become damaged and threaten to spread infection. The medical mask should not be disinfected with any alcohol-free sterilizer. The muzzle should be disposed of in case it gets wet or damaged. Wash hands thoroughly with soap and water before wearing the mask of any kind. Wear the muzzle in the correct way through the outer ends of it and avoid contact with the outside surface. When the muzzle is removed, it should be disposed of in the garbage, and then the hands should be thoroughly washed with soap and water. Not to wear a face mask that belongs to others. Avoid touching the mask from the area covering the nose and mouth to avoid transmitting the infection from the hands to the mask.